Crystal M. Bach. She is RN, Pediatric Immunization Nurse Coordinator from the Kentucky Department for Public Health, Division of Epidemiology and Health Planning Immunization Branch. She leads the Early Childhood Vaccine Connections Task Force, aligning healthcare leaders and pediatric advocates to address current challenges and improve child health outcomes. She also co-chairs the HPV Task Force. These are really two good individuals working for the benefit of all the members of the community. Today, I present to you Tara Pendygraft and Crystal M. Bach. Welcome, both of you. If you have your presentation and you would like to share it, you may do so at this time. I yield the floor to you.
Thank you, Dr. Batista. Hi, everybody. As Dr. Batista said, my name is Crystal Bach, and I'm the Pediatric Immunization Nurse Coordinator in the Immunization Branch at the Kentucky Department for Public Health. I am joined by my colleague, Tara Pendygraft, and I will let her do a quick introduction of herself.
Hello, thank you, Dr. Batista, for allowing us to join today. As you introduced, my name is Tara Pendygraft, and I'm the Education and Outreach Coordinator for our Immunization Branch at the Kentucky Department for Public Health.
Together, we are excited to share Kentucky's journey towards eliminating cervical cancer. Our initiative builds on national and global goals, but focuses on strategies tailored specifically to meet the unique needs of Kentucky communities.
So first, we just want to take a moment to express our deep appreciation for Operation Wipeout from the state of Alabama. Their team has been incredible partners from the very beginning, so they inspired our work, but they also taught us how to bring this to life here in Kentucky. From sharing experiences and resources and also walking through the steps of building a statewide initiative, their guidance has been invaluable to us. Operation Wipeout has also provided continuous support throughout our entire process, so they're always there to answer questions, review materials, and obviously cheer us on along the way. We really appreciate them, and we truly could not have launched this here in Kentucky without their support.
Kentucky continues to face significant challenges related to cervical cancer. Our state's incidence and mortality rates are both higher than the national averages. More than half of cases diagnosed in Kentucky are already in late stage, and rural communities experience lower Pap screening rates compared to urban areas. The Appalachian region in particular has nearly twice the national mortality rate. Rural women also face challenges in assessing screening, with only 48% reporting a Pap test in the past year, compared to 64% of urban women. These statistics highlight the urgent need for a coordinated statewide approach aligned with the World Health Organization's 90-70-90 goals: 90% HPV vaccination, 70% screening, and 90% access to treatment.
So we wanted to start by looking at where Kentucky stands. Compared to other states, Kentucky faces a disproportionately high burden of HPV-related cancers, particularly cervical cancer. The Southeast HPV Roundtable tracks key statistics to guide interventions, and unfortunately, the data shows that we have a lot of work to do here in our state. Although HPV vaccination rates have improved over time, they're still below those national averages. This reality underscores the importance that we have work to do, and we need to strengthen our HPV vaccination strategies, including vaccination as well as routine screening. To effectively eliminate cervical cancer in Kentucky as a public health problem, we must address these disparities by increasing HPV vaccination coverage and ensure that eligible individuals receive timely cervical cancer screenings.
So let's take a closer look at where Kentucky stands in HPV vaccine uptake. According to the latest data from the Kentucky Immunization Registry via the state's health tracking portal, Kentucky's full vaccination completion rate for adolescents ages 13 to 17 is approximately 47.9%. That means fewer than half of our teens are fully protected against HPV infections, an outcome that leaves us significantly behind our potential. By comparison, nationwide numbers are higher, and our goal is to reach at least 80% coverage for full protection. This matters because lower vaccination rates mean more individuals are at risk for HPV-related cancers, including cervical cancer, which is preventable with the tools that we already have. So a few takeaways. The data show a clear gap in uptake, and this isn't just about starting the series. For many adolescents, the series is not completed. The gap is even more pronounced in some regions of Kentucky, especially in rural and underserved counties, including Appalachian regions, where HPV-related rates tend to actually be higher. We have both a challenge and an opportunity. So if we can raise vaccination coverage closer to that 80% mark, we make major strides towards eliminating cervical cancer and other HPV-related cancers. So moving forward, our strategies must focus on increasing initiation and completion of the HPV series, addressing regional disparities and hotspots where coverage is especially low, engaging providers and parents alike. Strong provider recommendation remains a key driver of uptake. Using the registry and data surveillance to monitor progress, identify counties or populations lagging behind, and tailor intervention efforts accordingly. So in short, data show where we are. Now we must act decisively to move where we need to be for Kentucky's health and our future.
So the goal of this work group we created is to create and implement comprehensive data-driven strategy to eliminate cervical cancer as a public health problem in Kentucky. Through active participation, shared expertise, and coordinated efforts, we are working to identify barriers, explore best practices, and implement sustainable solutions to increase HPV vaccination, cervical cancer screening, and access to care. This work group serves as not just a discussion, but an opportunity to develop and lead initiatives that will save lives across our state.
The Kentucky Cervical Cancer Elimination Work Group was officially launched on March 4th of 2025. So this group is formed under the HPV Task Force and brings together stakeholders from across public health, healthcare, and advocacy organizations. Together, we're developing comprehensive strategies to increase HPV vaccination rates, expand cervical cancer screening, and improve adherence to follow-up care and treatment.
Our membership is intentionally diverse and includes health departments, health systems, cancer centers, managed care organizations, providers, advocacy groups, and survivor representatives. This diversity ensures that our strategies are practical, culturally responsive, and reach people in those communities that need them the most. Our partners share a strong commitment to the goal of cervical cancer elimination and represent many sectors across the state. They include health systems and cancer centers such as Norton and the Markey Cancer Center, the American Cancer Society, and St. Jude. Public health and screening programs are represented by the Kentucky Department for Public Health and the Kentucky Women's Cancer Screening Program. Our care delivery and payer partners include managed care organizations, Medicaid, and pharmacy representatives. Community and survivor voices are actively engaged through advocacy groups and survivor leaders, while the education sector contributes through colleges and partners working within Kentucky's school systems. Additionally, Kentucky Voices for Health, Rotary Club, and other members play an important role in advancing supportive policy and legislative efforts.
The steering committee is the leadership body that guides the vision, strategy, and implementation of the work group. Although the Kentucky Department for Public Health Immunization Branch initiated the effort, the steering committee ensures the initiative is collaborative and not solely state-led, bringing together stakeholders who can advance the work in their organizations and communities. The steering committee meets monthly to develop strategy, review progress, and plan broader workgroup meetings. It is comprised of cross-sector leaders representing immunizations, cancer screening and treatment, Medicaid and MCOs, primary care and gynecology, public health, and patient advocates, a structure designed to keep the work coordinated across systems. Our steering committee Members include Michelle Hill, Judy Theriot, Jordan Hatchett, Carrie McAfee, Destiny Osting, Siobhan Simmons-Wright, Dorsey Ridley, Patricio Menendez, Tara Pendygraft, and myself. Their mix of clinical expertise, program leadership, and lived experience strengthens our decision-making and outreach.
So our steering committee has 4 core responsibilities: to provide strategic direction and leadership by setting goals and benchmarks, plan and facilitate work group activities and shared learning, foster cross-sector collaboration to address systemic barriers to care, and to ensure sustainability and accountability through process tracking and progress tracking and advocacy for resources.
So to keep everyone connected, we developed a shared workspace where members can access everything in one place, from meeting slides and data reports to member lists, email templates, and communication channels. We also use surveys to collect input on priorities, new member engagement, and potential investment areas. This structure keeps communication open and ensures transparency across all of our partners.
So we wanted our logo and theme to reflect the collective identity of the group rather than just one organization or partner. To start, we divided into smaller breakout groups so everyone could contribute on ideas for design, color, and symbolism that they felt captured our mission and goals. After brainstorming, each group presented their ideas to the larger team, which helped us see recurring themes and shared values. We emphasized inclusivity, making sure the logo represented the whole work group's collaboration and purpose. Finally, we held a survey poll that allowed all members to vote, ensuring that the final decision was democratic and reflected the majority's voice. So this chosen logo has been shared with the KDPH Commissioner's Office to ensure that quality and accessibility standards are met. This process not only gave us a cohesive visual identity, but also strengthened our sense of shared ownership and unity. Kentucky Stamp Out is our rallying theme, designed to be memorable, action-oriented, and inclusive. It's intended to unify messaging across partners, mobilize community outreach, and anchor public awareness campaigns that encourage vaccination and regular screening.
So we continue to face several ongoing challenges in our work. These include vaccine hesitancy and misinformation, limited access to care in rural areas, and provider time constraints with competing priorities. We also see gaps in follow-up after abnormal screenings, which can delay diagnosis and treatment. By recognizing these barriers early, we can design solutions that are realistic, community-driven, and focused on promoting health equity.
This slide outlines the comprehensive multi-level approach we plan to take to stamp out cervical cancer in Kentucky. Our goal is to address this issue from every angle through community engagement, education, clinical support, and data-driven strategies. At the community level, we plan to launch the Kentucky Stamp Out campaign to raise awareness during key health observances and at local events across the state. We're currently working with MCOs to send targeted reminder postcards to parents of children ages 9 to 12 to encourage timely HPV vaccination, building on approaches that we've seen be successful in other states. Expanding access and education is another major focus. We're partnering with college campuses to host on-site vaccination days and using student ambassadors to reach their peers. In schools, we've launched pilot projects at the Alliance for Healthier Generation, working toward broader access through regional co-ops and school nurse associations. To support providers with practical tools, our HPV toolkit emphasizes starting the vaccine series at age 9, using default scheduling and incorporating reminder recall systems to close gaps. We're also coordinating with the Kentucky Women's Cancer Screening Program and managed care organizations to ensure strong navigation for anyone with abnormal screening results. All of these efforts will be guided by data, We plan to map HPV vaccination and screening hotspots to target our resources where they will make the most difference. Together, these strategies will form the foundation for Kentucky's future efforts to eliminate cervical cancer. We plan to do this one partnership, one county, and one community at a time.
So there are 3 key actionable steps that each of us can take to help eliminate cervical cancer in Kentucky. These are not just suggestions, they are proven interventions that have been successfully used by the team at Operation Wipeout in Alabama. The first step is HPV vaccination. We can all play a role by encouraging and supporting young people ages 9 to 26 to get the HPV vaccine and by talking with older youth or adults about its importance. The earlier the vaccine is given, the stronger the protection it provides. The second step is screening. For everyone who has a cervix, regular HPV and Pap tests beginning around age 21 are essential. Screening allows us to detect early changes before they develop into cancer. The third step is timely follow-up and treatment. When an abnormal result occurs, following up with a healthcare provider right away is critical, as treating precancerous changes is what prevents cervical cancer from forming.
Cervical cancer prevention takes everyone working together. College students and young adults can get vaccinated, lead awareness campaigns on campus, and speak up for their health. Policymakers and advocates can back prevention policies, fund community efforts, and share local data. Schools or school nurses can teach HPV facts, host vaccination days, and spark parent-provider conversations. Faith and community leaders can hold awareness events, connect people to screening and vaccination, and organize signups. Parents and families can stay current on vaccinations and screenings, model healthy checkups, and rely on trusted information. Health professionals can use every visit to educate, vaccinate, close screening gaps, and act on follow-up. So what can you do right now? If you're a parent, talk to your child's doctor about the HPV vaccine. If you or someone you know hasn't been screened recently, go ahead and make that appointment. And if there is any abnormal result that was never followed up on, now is the time to take action. Sharing this information with friends, family, and your community is powerful. When more people know, more people act. By putting these steps into motion, we can work together to eliminate cervical cancer as a public health problem in Kentucky, just as it's being done successfully in other states.
We created this call to action to help prospective partners understand how they can connect with Kentucky Stamp Out and how their work fits into the larger effort to eliminate cervical cancer in our state. Every organization contributes something important, whether it's vaccines, family education, screening promotion, or community outreach. Each piece moves Kentucky closer to becoming a national leader in cervical cancer elimination. For groups already doing work that aligns with Kentucky Stamp Out, we have gathered brief quarterly updates so we can highlight successes, share strategies that work, and recognize partners as part of the statewide effort. Together, this shared work can make cervical cancer a thing of the past in Kentucky.
Thank you all so much for allowing us to take the time to share these planning efforts behind our Kentucky Cervical Cancer Elimination Work Group, now known as Kentucky Stamp Out. We're very excited about the potential that this initiative has to change the overall landscape of cervical cancer across our state and to just improve the health of Kentucky women and families overall. Like we said, this is a collaborative journey. So as Crystal showed that QR code in the previous slide, please feel free to reach out to either of us if you have any questions, would like to connect, or just share some of the work that you're doing that we can highlight. Thank you.
Thank you very much to both. We have a question from Ms. Margolis.
Thank you very much. That was very informative. Thank you for sharing that data. Now, it's one thing to have a policy on out there on what your goals are. It's another thing to measure. And so I'd like some background on how you've measured previously, and I would like to receive the comparative data year over year to see how we're doing. And if you have it by county, that would be great. If not, just year over year, and then you can have the goals of what you expect. And what you should know is I was born in a healthcare family. My uncle ran university hospital, etc., and public health. So, and I'm a past chair of this board. So I've done healthcare all my life, a 45-year Humana exec. So just to give you some background on what to expect, what I expected in the answer. Thank you.
Dr. Ransdell?
Yeah, it's a
Can I
great
get
presentation.
can I get an answer?
Oh, Tara, please.
Yes, sorry. So we're in the very beginning phases of this with gathering partners and collecting data. So we just currently have created 3 different breakout work groups, and one is creating that action plan. So I think that will be the area we're going to be pulling together all of those things that you just discussed before we have our official launch. So this is a little like preemptive, I guess.
Okay, I get that. Let me rephrase. What I'd like to know is, surely does the department now have current data and data from last year and the year before? Not what, because your plan is wonderful.
So currently, what we pull as far as data, like far as immunization rates, we can only pull from KYR. And far as Kentucky, we're not IS mandated, so it's not really conclusive, but that's the best data that we actually can pull right now to go by far as
Okay, and what
vaccination
is
rates.
KYR?
It's the Kentucky Immunization Registry, and
That's
there's
perfect.
actually a health tracking portal where anyone can get on there and pull those rates. But as you can see on our slides when we shared, like we can only pull that certain age group and look at 1 dose or 2 doses. And then again, like Kentucky is not IS mandated, meaning that every provider in Kentucky that administers vaccines do not have to use that portal.
Correct.
So we
I
still
did
could
call
be
that.
missing some of those, but that is what we are currently using for our data as far as
Thank you.
immunization rates. And then we've also been using the HPV Roundtable of the Southeast. They pull together a Kentucky profile, and also the American Cancer Society
Can
and
you
some other
can you
groups.
give that to Arlena or to Dr. Patricia?
Yes, we can
Thank you.
share that.
Thank you to both. Dr. Ransdell?
Yes, it was a great presentation, and I appreciate it very much. The information initially referenced oral pharyngeal cancer as well, and my understanding is that the HPV vaccine covers that, and according to the research that I've seen recently, 70% of new cases of oral pharyngeal cancer are caused by HPV virus. How come you don't have a component of this to educate dentists and ENTs, to advocate to them, to advocate to their patients that they need to get this vaccine? According to the research that I just very currently did, 12,000 people die a year from oral pharyngeal cancer, and 4,300 die from cervical cancer. So to me, an additional push needs to be made with this information. It makes a lot of sense. And I'm just curious, I would be happy to serve as a conduit to at least with the dental part of it. But I think it's very important, and also somewhat unknown. A lot of the information gets pushed to the cervical cancer part of it, which is incredibly important, but very little information gets dispersed about the oropharyngeal cancers. And I appreciate your output, or whatever kinds of comments you would have towards that.
Yeah.
Oh, well, we
Can I take
actually,
that one?
Sure. Yeah.
Yeah, great points. And from a strictly scientific standpoint, you're absolutely correct. one of the limitations that we have is currently the HPV vaccine does not have an indication for prevention of oropharyngeal cancer. So even though scientifically it completely makes sense, and I don't think there's a lack of awareness in the physician and dental community that's relevant to this, but there's a lot of regulatory barriers and so forth that would need to be overcome in order to start marketing the vaccine from that end. The other thing is, and by the way, excellent presentation, guys. Really appreciate all the work that you're doing. Tara, I'm Dr. Goldberg. I'm a GYN oncologist as well as the representative from the Greater Louisville Medical Society. So certainly appreciate all the work you've done. I've left my contact information for you in the chat if you can circle back with me. But just want to emphasize here for everybody, there are a few cancers that we can nearly completely eliminate with one fell swoop. Even more strongly than the relationship between smoking cessation and lowering the risk of lung cancer, almost every case of cervical cancer I see is completely preventable. Other countries in Europe, through better vaccination, have cut their rates of cancer, of cervical cancer in young women by about 90% over what we've seen historically. So this is an enormous gap between what we're actually doing for our citizenry and what's possible. So I really laud your efforts. Very much like to work on this. Unfortunately, I have to run off to the OR, but thanks again for the presentation.
Thank
Thank
you
you.
very much, Dr. Jeffrey. Go ahead, Tara.
Thank you so much. And I wanted to kind of circle back to your question, Randy. So we do still have our HPV task force, which we work on all of the types of cancer that HPV is related to. And we actually have just connected with our dental or oral health program at the Kentucky Department for Public Health to explore that avenue further, because we know that's a very great place to get in and to be talking about oral pharyngeal cancer. But the reason that we've gone cervical cancer, from the HPV Southeast Roundtable, they presented a call to action for all of the southeastern states to start an elimination plan. And from my understanding, based on the data of having pap smears and screenings, we have better data to be able to officially eliminate this as a public health problem, where some of the other HPV related cancers, we don't necessarily have the data to be able to, like he was saying earlier, to be able to prove that we've eliminated or made strides towards.
Maybe what we can do, Dr. Ransdell, is to send to you all the information for the HPV task force, so you can become involved and become part of the work group and work along with Crystal and Tara. And thank you so much, Dr. Goldberg, for your participation. And the idea is to not only bring awareness, but to establish these working relationships. The main reason I invited Tara and Crystal to present today is because I have participated in the workforce HPV, and also I've been part of the Stamp Out program development. But what strikes me the most is the energy and the goodwill this team has. They go to colleges, they provide HPV vaccines to college students, they invite them to take this matter into their efforts. And this is something that, along with vaccination for kids, we should be doing more purposely. So thank you so much. Do we have anybody else with questions or comments for the presenters?
Yes.
Yes, go ahead, Marta.
Good morning, ladies. Marta Sanchez. I work with Gilda's Club. We're a cancer support community. So I'm thinking that we are going to connect because I would like to help with the initiatives. In addition to that, just 2 points that I wanted to throw out there for you to consider. One of them, and I'm pretty sure you've taken care of that, the language access component. One of them being the fact that specifically Hispanic communities are approached in a different manner when it comes, to disseminating information. We're finding that out over at Gilda's, as I'm the one that does outreach and also develop programs for our Hispanic community. The other thing would be the stigma behind cervical cancer. I'm a survivor, and I have a lot to share about that particular topic. So I'm going to see if I can get your information, and we'll stay in touch. And if there's anything that I can provide help out with, more than welcome to. And thank you so much for this information. It's really interesting to know that a lot of people don't know about these things. I didn't know myself, but yeah, thank you. And thank you, Dr. Patricia, for allowing them to speak on this topic.
Thank you so much. Dr. Ransdell has the last question. And this is, have the European countries that have increased HPV vaccination rates shown a concurrent decrease in oral pharyngeal cancers? Do you know, or does anybody have this information?
I apologize. I do not have that information right now. I would definitely be interested in looking into it, though.
Thank you.
We would appreciate that. Thank you so much. Thank you so much, Tara. Thank you so much, Crystal. Your participation has been great, and I just wanted to highlight what you're doing. Ms. Margolis, do you have anything else? No. Okay. Thank you so much. Appreciate it very much.
Thank
And now
you.
we will
Chair
continue our.
Batista Severa, I believe Ms. Manson has a question.
Oh, Ms. Eleanor, please go
Yes,
ahead.
I raised my hand, but it didn't raise. My computer's doing wild things this morning. I just want to say this is a very good presentation, and the KNA is collaborating with Merck about vaccinations. And I think we also have a school nurse SNP, a special nurse interest practice group, where this information could be part of what we are focused on. I have nurses as collaborators to this initiative. There are 93,000 of us, and we impact most of the healthcare communities in the state. So I would like to invite you to have us to be part of the solution.
We would love that. Absolutely. Mariah and Delanor, if you would want to put your all's email in the chat, we'll make sure to reach out and send you an invite to these groups.
Thank
And I
you.
also wanted to respond real quick to Maria. I really appreciate you sharing your experience and your story, and that's something that we found very invaluable in our work group. So we do have one person who's a survivor, and she's taught us far more than we could ever learn by researching this information. And we are partnered with Gilda's Club, so we've been connected with someone named Lori Magnum. So I'm not sure if you all are connected in any way, but we would love to have you join us, and we really appreciate you sharing that.
Yes, I do know Lori. She's actually my supervisor. I'll speak to her about it today.
Thank you so much. We have developed, the relationships and the things that we need to convey and to keep on doing this good job. Kentucky Nurses Association is a good way to spread the word. And of course, Gilda's Club. Thank you so much. Appreciate your presence today. We will continue now our agenda and allow, yes?
No, I'm good.
And we'll continue our allowed time and space for our updates and reports. For the Mayor's Office update, now I yield the floor to Deputy Mayor Nicole George. Deputy Mayor.
Good morning, everyone. What a great way to start the day in terms of information and action. Want to say on the front end, Happy New Year. And as part of that new year, Mayor Greenberg meets with all of the agency directors to talk about and recognize accomplishments from 2025, as well as priorities going into 2026. So Mayor had an opportunity to meet with public health leadership this week. I'll certainly let Connie speak to more details on that, but we'll say that we are looking forward to supporting the health department's initiatives and priorities this year around the reduction of hepatitis C, the increase of childhood immunizations, support for the reduction of lead, elevated blood levels for children with lead, and reduction of underage tobacco sales and enforcement of the tobacco license. Mayor Greenberg would love to see the Board of Health support priority areas in an attempt to really just maximize impact in our community and drive outcomes for these efforts. The health department is doing a tremendous job, but like many metro agencies, there's far more work to be done, and we really depend on community in this way. So just want to say my call to action to the board today is to really think about the priorities that the health department has set, also reflected in their strategic plan, priorities that the mayor's office will be supporting this year, and in ways that the Board of Health can plug into and support those initiatives for collective impact. So with that, have a happy new year, and I look forward to hearing other updates.
Thank you very much. Now, the director's update. I yield the floor to Louisville Metro Public Health and Wellness Chief Health Strategist, Connie Mendel.
Hello. Happy New Year. It's great to be working with you and serving our community in this new year. As Deputy Mayor George mentioned, we have created a strategic plan for our department and for our public health community. We are focusing on very specific areas where we can make, where we think we can make big change in our community and a healthier community. So we'll have more information to share on that, but also we would love your participation. And so we're going to share with you our strategic plan, and we'll meet together to talk about where there are areas that the Board of Health can really dig in, and where you think you all can make the most change. So these are really critical as we talk about hepatitis C, with unfortunately, Kentucky being one of the worst in the country with hepatitis C rates. We're also concerned about congenital syphilis, something that we should not be dealing with in this time and age, but it continues to increase. Also with childhood lead poisoning preventions and maternal child health in general, as we look at our low birth rates for Jefferson County, low birth weight and premature births. So these are areas that are important that we address and have much better outcomes. So specifically, as Deputy Mayor mentioned, immunizations is an area that we've continued to work towards increasing childhood immunizations. I'm sure you're all aware of some recent announcements as far as what are recommended vaccinations for our children. We are following the American Academy of Pediatrics and the Kentucky Department for Public Health as we look at what are our recommended childhood vaccinations, and we continue to support those, the schedule that you're more familiar with. As we look to vaccinations, for instance, for hepatitis B, we still recommend those for children and infants. Before hepatitis B vaccinations were given the birth dose, the U.S. saw 18,000 children a year that were infected. We also continue to recommend the rotavirus vaccinations. Before, that was a regular vaccination given to infants and children. There were 70,000 children hospitalized annually with rotavirus. We're going to continue to recommend the HIV vaccination, which is the leading cause of bacterial meningitis in children. So these, along with the measles, mumps, rubella, obviously with flu, are important to keep our community safe and to keep those numbers as low as possible. You all have a copy of the January report. As Dr. Batista mentioned earlier, we are seeing pertussis cases on the rise in Kentucky, a vaccine preventable illness. We're also seeing flu cases. So we want to recommend for everyone to get your vaccinations. It's not too late if you've not received a flu vaccination to go ahead and do that. And please encourage your clients and patients to do the same. There's more information on hepatitis B. So I know it's that time of year and that message, but we can't share this message enough. It's important for us to get vaccinations and recommend those vaccinations. So with that, I see Dr. Single is able to join us. Did you want to share some information?
I think you covered it all. If you guys want to see the vision clinic, how it works, I can turn the table around and show you. So sorry, doing two things at a time.
No, it's wonderful. Yeah. Okay. So we yield the floor back to you, Dr. Batista. Surveys for.
I'm sorry. Thank you very much, Chief Health Strategist. Thank you, Dr. Single. Now we go to Family Health Centers. Now I yield the floor to you for your report, Dr. Bart Irwin.
Thank you very much. Happy New Year to everyone. I wanted to start off the year with a couple bits of good news. So as you may know, in 2025, Housing and Urban Development Department was moving to cut permanent supportive housing funds to communities by as much as 70%, which would have been devastating for folks who were previously homeless and are now in housing, permanent housing. About 1,200 people in the metro area would have been at risk of losing their apartments and their permanent housing vouchers. But a federal judge stepped in and blocked that. So at this time, that's not going forward. But we certainly expect Housing and Urban Development to come back with a similar effort in the future. A second piece of good news is about the 340B program, which you may or may not be familiar with. This particular program is a federal program, although it doesn't involve any federal funds. It allows family health centers and other safety net medical providers to purchase medications at the 340B price, which is steeply discounted. It's a federal agreement with the drug manufacturers for this purchase price. And then we distribute that medication to our patients. Well, HRSA, Health Resources and Services Administration, came out with a trial program where community health centers and other safety net providers would have to purchase these medications at the wholesale price rather than the 340B price, which would be devastating to a lot of rural health clinics, rural hospitals, urban hospitals, and community health centers. That means that for 10 medications during this trial, family health centers would have to purchase those at the wholesale price. And based upon last year for these 10 medications, we paid $126,000 to purchase the medications to distribute to our patients. Under this trial program, we would have had to put up $5.6 million to purchase the same quantity of medications in 2026. Outrageous. Couldn't do it. Community health centers across the country couldn't do it. So thankfully, again, a federal judge stepped in, prohibited this trial from going forward until it could be further investigated. So those are two pieces of good news. Family Health Center will continue to lobby for our patients and our health centers across the country. And in February, many of us from Family Health Centers will be going to Washington to talk to legislators about these issues and about other issues that affects community health.
Thank you so much, Dr. Irwin. Good news. So let's hope for more of those. For healthcare coverage and outreach, I now yield the floor to Ashley Shoemaker.
Yes, so the coalition met on December 8th, and the main topic of discussion was the expiration of the enhanced tax subsidies. Those enhanced tax subsidies did expire on December 31st. So Kentuckians are seeing plans increase on average $100 a month. That is about a 42% increase compared to 2025. The good news is that as of last month, new enrollments, this open enrollment, are outpacing terminations for the first time this open enrollment. So we are seeing more people enroll in plans for the first time than we're seeing people terminate their plans. The largest group that is terminating their plans are households with income of over 400% of the federal poverty level. That's about $62,000 a year for a single individual. People with income above that income level are no longer eligible for any of the tax subsidies right now. And so they're seeing the largest premium increases, and they're the ones that are primarily choosing to terminate their coverage. What we are seeing in the people that choose to remain covered is that they are switching plans from silver level plans to lower level bronze plans. Those plans may have more affordable monthly premiums, but the concern is that they have higher out-of-pocket costs. These are high deductible plans. So, there's concern about access to care with that because, even though people are enrolling in coverage, they have coverage, they might be less likely to come in and see a provider if they know they're going to have a higher, copay, or if they have to meet their deductible first, but before the visit is covered. So that is something that we are watching. There is a bill that has some bipartisan support in the House that would be a 3-year extension of the enhanced tax subsidies. I believe they're likely to vote on that this week, but it remains unclear what would happen in the Senate. So we do encourage everyone, if this impacts you personally or your patients, if it's something that you're concerned about, to please reach out to your elected officials, and ask them to extend these enhanced tax subsidies to keep plans affordable for Kentuckians. So open enrollment does end on January 15th. If there is an extension of these enhanced tax subsidies, there would likely be a special enrollment period for people to go in and shop for plans again, because a lot of people, like I said, have chosen to they chose to go without insurance, or may have switched to lower level plans. So there would likely be a special enrollment period to give people the option to go back and take another look if these premium prices change. So our next coalition meeting is scheduled for February 9th at 4 o'clock. So does anyone have any questions? Thank you.
Thank you, Ms. Shoemaker. Reach out to your elected officials, make a pledge for the extension of the tax subsidies, and let's support our community. Thank you so much, Ms. Shoemaker. There is not an update for the Immunization Advocacy Committee. For JCPS Health, Dr. Everstone has assigned 2 members of the JCPS Health team to represent for the Board of Health meetings and the Immunization Advocacy Committee, but I don't see them today, but no updates on their behalf. For Greater Louisville Medical Society, now I yield the floor to Dr. Jeffrey Goldberg. Dr. Goldberg.
Chair, I believe that he stated he had a surgery to go into.
Okay, thank you so much, Charlana. For the Kentucky Nurses Association, now I yield the floor to Ms. Delenor Manson.
Good morning. As I said, I've been having some video and audio problems this morning. Want to mention that we had our gala in November and our conference with great turnout. We are scheduled to do our Nurses Day at the Capitol on February the 5th, where we'll be at Kentucky State University. Our focus for this legislative session is going to be on workplace safety. We'll have a bill, and I'll be coming back asking for some support for that. Our press release related to education for nurses and nursing deemed as not a professional practice. I hope that you will read that and contact your legislators to say nursing needs to be deemed a profession so that we may be eligible for education dollars so that we can, I mean, right now there are approximately 14,000 APRNs in the state of Kentucky. And in 49 counties, APRNs are the primary care provider for most of those primary care opportunities. So we need to get more nurses with master's degrees so that they can be professors to teach nurses, so we can continue to increase the number of nurses in the state of Kentucky, because we have a shortage already and it's going to increase exponentially. So if you have not had the opportunity to read the press release, please do. And please make an effort to contact your legislators to say, please support nurses to be deemed a profession so that they will be eligible for funding to continue education.
Thank you very much. Appreciate it. Please read the release. Is there any old business?
Chair Batista Severa, I believe
Yeah.
Dr. Single has his hand up.
Oh, go ahead, Dr. Single.
I just have a quick comment. Eva is, I know, busy here. So one of the things that, since I'm on the call, the mayors and the health department and JCPS and the whole city, our part of strategic plan is how do we make sure that children and adults too, but children are immunized. And what we learned from the Washington Post article and then the NBC News article, there is a gap in reporting. It's not just that, I'm not saying we don't have a problem, we have a problem, but the problem is magnified exponentially due to lack of reporting in the KIR. So one of our push is going to be this coming, next quarter, strategize how can we, all of us on this team, the Board of Health, how do we go to our colleagues and push for them to report to KIR registry so the data is current, and that way we can serve these children well. And Eva would have said that if she was here.
Thank you, Dr. Single. This was an issue when the Kentucky Immunization Registry started, and it is still an issue, and we need to support the enforcement of registration, because we need to know the correct. There is a lack of reporting in KR. That's what Deputy Mayor says. So we will support this effort, and we will, as a Board of Health, we will support the Louisville Metropolitan Health and Wellness work on this.
Thank you.
Thank you so much. Regarding new business, the Kentucky Association of Local Boards of Health, CALBO, is inviting a statewide Board of Health meeting, and this is scheduled for January 21st from 6 p.m. to 8 p.m. This is via Zoom. Ms. Arlena Glenn will share the agenda and the Zoom link. And this is a really important meeting because it's statewide. And as a board members for the local board for Jefferson County, it's an eye-opener to be in contact and to interact and to listen other board members from different counties and all across the Commonwealth. Dr. Stephen Stack, the Health and Human Services Cabinet Secretary, will talk about first the federal changes impacting local health departments. There are going to be different mentions of incoming meetings. Also, the National Association of County and City Health Offices, NALSCO, is happening in September in Louisville, Kentucky. So I'm inviting, and Chief Health Strategist has been also really interested for all the board members and everybody present here to participate and listen to what other local board of health associations are doing across the state. If there's no other issue or topic to discuss, I'll adjourn the meeting. Thank you everyone for taking time to participate in this month's meeting. The next meeting will be held on Wednesday, February 4th at 8 a.m. This will be a virtual meeting, and I'm taking the opportunity to consider before March, let's get together in person, and we will start slightly earlier instead of 8, maybe 7:30, so we'll have enough time to go back to our regular activities. And this it's going to be scheduled at the Gray Street Louisville Metropolitan Health and Wellness Building. So please keep this in mind, an in-person meeting to discuss how, as a Board of Health members, we will be supporting and helping what the strategic plan that Louisville Metropolitan Health and Wellness is developing. If no further business, the meeting is officially adjourned. Thank you very much, everybody.